The heart monitor screamed into the silence of the ICU like a desperate cry for help, its jagged lines trembling as if they, too, were afraid of what was coming next. 20 doctors stood frozen behind a glass wall, their faces pale, their shoulders slumped under the unbearable weight of failure. In the center of the room lay a 17-year-old girl, her chest barely rising, her skin ashen, her life slipping away with every passing second. She was the daughter of a decorated U.S. Navy admiral, and despite the best efforts of the nation's finest medical minds, she was dying. Just as hope was fading completely, a rookie nurse stepped forward, carrying a secret technique learned far from any hospital, a method born on the battlefield. What happened next would forever change the lives of everyone in that room. If you believe in kindness, courage, and second chances, take a moment to like this video, share it with someone who needs hope, leave a comment, and subscribe to the channel for more heart-touching stories like this. The hospital stood on the outskirts of Norfolk, Virginia, its massive concrete structure overlooking a quiet stretch of water where Navy ships glided in and out like silent guardians. Inside, tension filled every corridor as word spread that Admiral Thomas Carter's only daughter, Grace, was losing her fight for life. For 3 weeks, she had battled a rare neurological infection that attacked her nervous system, causing seizures, organ failure, and terrifying episodes of respiratory collapse. Every treatment known to modern medicine had been attempted. Specialists had flown in from across the country. 20 doctors, some of the most respected in their fields, had exhausted every option. Now, all they could do was watch and wait, hoping for a miracle they no longer believed in. Grace had been a vibrant, athletic teenager, full of laughter and fierce independence. She loved sailing with her father, volunteering at animal shelters, and dreaming of one day becoming a marine biologist. Seeing her now, motionless and pale, shattered the hearts of everyone who had known her. Her mother, Margaret Carter, sat beside the bed day and night, whispering prayers and memories, her fingers wrapped tightly around her daughter's limp hand. Admiral Carter stood rigid at the foot of the bed, his uniform immaculate, his posture unyielding, but his eyes betrayed a depth of fear he had never known, even in war zones. Among the medical staff was a newly hired nurse named Hannah Brooks, just 24 years old, fresh out of training and barely 2 months into her job. She moved quietly through the unit, doing her best to blend in, aware of how little authority she carried among seasoned doctors and veteran nurses. Yet Hannah carried a past that few knew about. Raised in a military family, she had spent much of her childhood moving from base to base. Her older brother, Michael, had been a combat medic in the Army, and before his death in an overseas conflict, he had taught her unconventional emergency techniques designed for situations where standard equipment and time were luxuries. These methods were rarely taught in civilian medical schools, considered too extreme or untested, but in the chaos of battle, they had saved countless lives. Late one night, as rain battered the windows and thunder rolled across the sky, Grace went into sudden cardiac and respiratory distress. Alarms erupted, and doctors rushed in, initiating resuscitation protocols yet again. Minutes passed in a blur of frantic motion, but nothing worked. Her oxygen levels plummeted, her heart rhythm became dangerously unstable, and one by one, the doctors began to step back, their faces grim. The lead physician, Dr. Richard Holloway, finally shook his head, his voice heavy as he declared that they had reached the limits of what medicine could do. It was in that unbearable moment that Hannah felt something stir inside her, a memory of her brother's voice echoing in her mind, reminding her that sometimes survival demanded boldness. Her hands trembled as she stepped forward, her heart pounding against her ribs. She spoke softly, almost afraid to be heard, suggesting a last resort technique involving a combination of manual nerve stimulation, controlled hypoxia exposure, and targeted chest compression patterns designed to reboot failing autonomic responses. The room fell silent. 20 pairs of eyes turned toward her, disbelief and skepticism etched across every face. Dr. Holloway hesitated. The method was risky, unconventional, and unapproved. If it failed, the consequences could be severe. But as he looked at Grace's rapidly deteriorating vitals, he realized there was nothing left to lose. With a reluctant nod, he allowed Hannah to proceed. Time seemed to slow as she began. Every movement was precise, guided by muscle memory and countless hours of practice with her brother. She focused intensely, blocking out the noise, the fear, and the crushing pressure of knowing that a single mistake could end a life. Sweat beaded on her forehead as she worked, silently pleading for strength and clarity. Seconds stretched into minutes, and just as despair threatened to return, the heart monitor emitted a steady, hopeful rhythm. Grace's oxygen levels began to climb. Her chest rose more evenly, and a faint flush returned to her cheeks. A collective gasp rippled through the room. Doctors stared at the monitors in stunned silence, barely daring to breathe. Slowly, cautiously, they eased back into action, stabilizing Grace and securing her airway. Within an hour, she was no longer in immediate danger. The impossible had happened. Word of the miracle spread quickly through the hospital. Nurses whispered in hallways, and doctors exchanged astonished glances, struggling to comprehend what they had witnessed. Admiral Carter, informed of the sudden turnaround, rushed back to the ICU, his stoic demeanor finally cracking as he saw the steady rise and fall of his daughter's chest. Tears streamed down his face as he clasped Hannah's hands, unable to find words that could express his gratitude. Over the following days, Grace's condition steadily improved. Though weak, she began to respond to stimuli, squeezing her mother's hand and fluttering her eyelids. Each small sign of recovery felt like a victory. Hannah visited her often, quietly checking her vitals and adjusting equipment, never seeking attention or praise. Yet within the walls of the hospital, her reputation transformed overnight. The rookie nurse became a symbol of courage, innovation, and unwavering belief in the face of hopelessness. When Grace finally awoke fully, her first clear words were a soft thank you, whispered to the young nurse who had refused to give up on her. The bond that formed between them was profound, a connection forged in the fragile space between life and death. For Admiral Carter, Hannah became family, an embodiment of the selfless service and bravery he had dedicated his own life to defending. Months later, Grace walked out of the hospital under her own power, sunlight warming her face as she took her first deep, unassisted breath. Reporters gathered, eager to capture the story of the girl who had beaten impossible odds, but she always redirected the attention to the nurse who had saved her life. Hannah, ever humble, spoke only of teamwork, perseverance, and faith, insisting that miracles were born from collective effort and hope. As life gradually returned to normal, Hannah continued her work, carrying with her the quiet knowledge that sometimes the greatest acts of heroism happen far from the spotlight. And Grace, forever changed by her ordeal, dedicated herself to helping others, volunteering in hospitals and inspiring patients who faced battles of their own. If this story touched your heart, please take a moment to like this video, share it with someone who needs hope, and subscribe to the channel for more inspiring stories. Your support helps keep these powerful messages alive. Before we end, leave a comment telling us what part of this story moved you the most, and let us know if you believe in miracles born from courage and compassion. Because in a world filled with uncertainty and pain, it is often the quiet bravery of ordinary people that becomes the extraordinary force capable of saving lives, reminding us that even in our darkest moments, hope can still rise, steady and unstoppable, like a heartbeat returning from the brink.